Thank you to Dr. Boron and to the faculty and staff at El Paso for putting this very informative and timely webinar on. It is my pleasure to present the John F. Haynes Jr. Award to one of my fellows here at UT Southwestern. This year, we are privileged to have 4 excellent fellows. While they make my job as their program director easy, the decision to select one excellent fellow was extremely difficult. This year, we would like to honor Dr. Kim Aldy with the John F. Haynes Jr. Award for her contribution to our fellowship into the specialty of medical toxicology. Dr. Aldy has established herself as a toxicologist with an unparalleled work ethic and outstanding character. While managing her fellowship duties, she has involved herself in innumerable research projects, received a training grant to study ultrasound on snake bites, received a travel award to NECCT, named the best resident presenter at a regional SAEM conference in Dallas, participated on the ACMT Board of Directors as the intern representative for the Toxic Registry, and published 3 articles on vaping-associated lung injury. She has become an innumerable member of our toxicology service at UT Southwestern and of the North Texas Poison Center. So, Dr. Aldy, please accept this digital certificate in this time of social distancing, and we will provide you a physical copy in the near future, I hope.
Absolutely.
Congratulations.
Thank you. Thank you so much for your kind words. That was awesome. Unexpected. Okay, great. All right, so I am Kim Aldy. I'm one of the medical toxicology fellows at UT Southwestern. Today I'm going to be talking about pesticides, pest pillagers, plagues, and poisons. So my disclosures, I have no financial interests or relationships to disclose. I'm only a fellow. Conference disclosures. So the funding for this conference was made in part by APSDR, and the views of my presentation today don't reflect the policies of DHHS or APSDR. They are of my own, and any trade names that I mention are not endorsements, definitely not endorsements. All right, and PSU. So just a little plug for PSU, the National Classroom. Their website has a lot of resources for more information about environmental medicine and health in children. So our objectives today are to know the general types of pesticides, to learn the most concerning toxicities associated with pesticide exposure, and to describe the basic management after pesticide exposure. First, we're going to go through a little pre-test. So question number 1, what is the governing body for pesticide regulation? So it's actually the EPA. And we'll talk about that soon. Question number 2. So a 3-year-old child drinks from a plastic cup on the counter that was being used to spread an organophosphate pesticide around the kitchen to deter roaches. What type of symptoms are expected from the significant exposure? So the answer here is actually B, tachycardia, salivation, and diarrhea. A lot of these look pretty similar, right? Tachycardia is the first answer on all of them. And we'll talk about how you'll know the differences here in a bit. All right, pre-test question number 3. So products with DEET as a repellent are safe for dermal use in children because this compound is not absorbed. True or false? The answer is false, and we'll also discuss that. Question number 4. Paraquat ingestions can cause long-term complications such as, the answer here is pulmonary fibrosis. Actually, in paraquat ingestions, what happens is the alveolar cells take it up into the lungs and cause reactive oxygen species, which damages the cells and leads to long-term complications like pulmonary fibrosis. All right, so why are we talking about pesticides right now? I mean, we had 2 wonderful lectures this morning about very relevant things, but right now, you know, a lot of people are home. A lot of kids are home. They're on quarantine with their parents. The cabinets are wide open, and a lot of toxic substances are kept there. So I really anticipate that a lot of the poison centers will receive more calls about congestions in children, as well as exposures to pesticides. In addition, people are going outside more, being with the family a little bit more, which is great, but a lot of times, you know, children are getting sprayed down with different chemicals to help them be safe outside. All right. Definition of pesticide. So basically any substance or mixture of substances that's intended for preventing, destroying, repelling, or mitigating any pests. This includes insecticides, rodenticides, and fungicides, and anything that's used as a plant regulator, defoliant, or desiccant is also a pesticide. Specifically, these are herbicides. So today I'm really going to talk about insecticides, rodenticides, and herbicides. So the regulation of pesticides, I promise we talk about this. So it's registered, all pesticide manufacturers are, that are in the U.S. have to be registered and licensed by the EPA. And the way that this is regulated is under the Federal Insecticide, Fungicide, and Rodenticide Act, or FIFRA. This was enacted in 1947, and it's enforced by the EPA since 1970s. So what is FIFRA? So FIFRA is basically has all these stipulations. So one of them is, they need to be registered with the EPA. Also, pesticides have to be classified as either general use or restricted use. Restricted use meaning professional use, like on a golf course or something like that. And those people that use those restricted use pesticides have to be licensed to do so. Also, the other thing is that some of the rodenticides, actually all the rodenticides, are classified by their toxicities based on the Aldy 50, and this label, which we'll talk about, which is a signal word, it has to be on the label of that product. FIFRA also defines a lot of other things. They want to make sure that, the adverse effects on the environment are not unreasonable, so that also has to be taken into account. And also dietary risk issues like pesticides in our food. So there's this paradox of pesticides. It really benefits society and it can protect us from diseases, but the biggest issues are that it contaminates the environment and it's associated with many health risks. And in addition, it just provides people that want to have intentional exposures access to something that may harm them. So pests throughout history, one way the risks and benefits of pesticides really to remember that pesticides are really for our protection. The bubonic plague is an example of how these pests had spread disease, a devastating disease. In the 14th century, the plague killed 30 to 60% of Europe's population. And this plague was really thought to be passed by fleas that were carrying the bacteria Yersinia pestis. And the fleas were spread by rats, which roamed around the city freely. So it really, benefits us to have these pesticides to prevent any future plagues. Now, plague doctors, they used to wear this mask that you see here in the picture with this bird-like beak, and that was to protect them from being infected by the disease, which they believed was airborne. And in fact, they actually thought this disease was spread by bad air. So kind of similar to what we're dealing with right now, wearing masks all the time. So another event that happened due to pests was the Irish potato famine of the 1840s. Basically, this was a destruction of Ireland's potato crop, and that was due to the fungus that grew in potatoes. The harvest was significantly decreased, about a half to a 3/4 decrease for about 8 years. And the potato famine actually resulted in the death of 1 million Irish from starvation and related causes. So, if they had had pesticides, then this may not have happened because the fungus would not have grown on the potatoes. There's a lot of ancient pesticides that we know are harmful today and we do not use anymore. In the 1600s, ants were actually controlled with mixtures of honey and arsenic, and that would kill them. And then there's this Paris green that was used on potato crops and tobacco crops. It was one of the first chemical pesticides in the U.S., starting in 1867. And it was initially used to control outbreaks of the Colorado potato beetle, and it's basically copper arsenate. And then one of the other herbicides that was used was Bordeaux solution. This is a mixture of copper sulfate and calcium hydroxide, and it was used by the French grape growers in the 1800s because they noted that it would turn their wheat black, so then it would allow the land to be used to grow the crops that they desired, which were the grapes. So pesticides in our food. So since 1987, actually, the FDA has been analyzing pesticide residues in random food samples in the U.S. So in 2017, about 48% of foods purchased by Americans had a detectable level of residue. And in addition, 3.8% of that had levels above legal tolerance amounts. So you can see here, looking at, samples with residues, that were violative. In vegetables, 9.4%. That's kind of a lot. All right, so per the CDC from 1999 to 2008, there was an average of 23 deaths per year from pesticide exposures. 67.9 were intentional poisonings, and 25.2 were accidental deaths. So still a lot of percentage that's accidental. And then there was less than 1% that was due to assault. I'm guessing that was poisoning someone else. And usually the deaths are from the intentional ingestion, but you have to remember that accidental deaths are pretty common. So the WHO has a classification system for pesticides, and basically it's based on the LD50. So the LD50 is a lethal dose that kills 50% of the rats, and this is on a mg per kg scale here. And this kind of tells you what these can be classified as. All right, so let's get into it. Let's talk about insecticides. This is going to be the bulk of my talk today. There's just so many interesting ones and classic things that you should know. So these are insecticide classes. And first we're going to talk about cholinesterase inhibitors, and that actually is organic phosphorus and the carbamate. So cholinesterase inhibitors. So these are organophosphates and carbamates. They inhibit the acetylcholinesterase enzymes. So in the normal scheme of things, what happens is acetylcholine is released into the synapse, and that binds the ACH receptor and causes the cholinergic symptoms, so you get muscarinic and nicotinic symptoms. However, acetylcholinesterase kind of helps us because it breaks down any excess acetylcholine. That way you don't have overbinding and too much cholinergic symptoms. The issue with organophosphates is that they bind the acetylcholinesterase and render it inactive, and so it cannot break down any of the excess acetylcholine. So you get more cholinergic symptoms when organophosphates are acting. So what are cholinergic symptoms? So here's SpongeBob. He's going to tell us what cholinergic symptoms really are. You can see that for muscarinic effects, those are mostly parasympathetic. Those are the things that we like to call dumbbells. And it just basically means that you would have a lot of secretions out of every orifice, and you would also get bradycardia. In the nicotinic effects, those are mostly sympathetic, right? So fight or flight. So in this one, you would have more sympathetic effects, things like tachycardia, but also seizures and weakness, paralysis. So this is SpongeBob, and he's actually seizing here. So organophosphates, in particular, were the basis of many chemical warfare agents during World War II, like sarin. And they're basically grouped by their leading group, which is the one I've circled here. Parathion was developed in Germany in the 1800s. And this one in particular, they used to call the mother-in-law poison. I'm not even going to try to say that, but that's what they used to call it, I guess, kind of tongue-in-cheek. But it had a resurgence in the 1940s, and you know, it's been used as an alternative to organochlorides. In the U.S. since 1966, there have been a lot of deaths actually from this in agricultural workers, and it's got some restricted use in the U.S., but it's still going to be used in those occupational settings. So some of the delayed sequelae, in addition to the muscarinic effects and the nicotinic effects we talked about, are an intermediate syndrome and organophosphate-induced delayed neuropathy. In intermediate syndrome, you can have paralysis that occurs 24 to 72 hours after that initial exposure, and then the recovery is usually within 1 to 2 weeks. And that's from the redistribution of that pesticide from fat stores. The issue with organophosphate-induced delayed neuropathy is that, you know, it's caused by many different organophosphates, but usually TOCP, which we don't use as often anymore in the U.S., but the cause is really unclear, and it causes this peripheral neuropathy that is basically from feet up, what we call a dying back neuropathy. And this onset can be 1 to 3 weeks after exposure. And the biggest issue is that it could be permanent. All right, let's talk about carbamates. So carbamates, one of the ones that's classic is aldicarb, but most all of them have carbs at the end of the name. Basically, these are reversible inhibitors of acetylcholinesterase, unlike the organophosphates, which were irreversible. So these have a shorter duration of symptoms, and there's a little less risk of those delayed syndromes that are so bad. Let's talk about the management of both of these. So basically, you should decontaminate the patient and stabilize them. You got to remove their clothing because there can be some dermal absorption. You should irrigate their skin so that they're not continuing to absorb, and then manage their airway because they may have a lot of secretions like we talked about. Also, you can give benzos for the seizures from the nicotinic effects, and if there are any arrhythmias, things like magnesium or bicarbonate could help. There are actually some good antidotes for both of these. Atropine should be given for both. It can help, but for organophosphates in particular, pralidoxime can also help. So atropine. So we talked about here where the organophosphate binds the acetylcholinesterase and leaves it not able to act on the ACH. That increases the cholinergic symptoms. What atropine does is it can directly stimulate block the ACH receptor, and what happens is you will basically not get some of the effects of the cholinergic symptoms, so the ACH can't bind. But that's really the muscarinic sites, and the nicotinic will still occur. So you'll still have that paralysis and some of the seizures. What pralidoxime does, and why we use it, specifically for organophosphates, is it can remove the organophosphate from the acetylcholinesterase if you give it within a certain period of time, depending on which organophosphate it is. And so once it removes from that, then that can go and break down all the acetylcholinesterase and decrease the nicotinic symptoms. So those two things in particular can help. Okay, so neonicotinoids, this is the next group that we're going to talk about. So these are nicotine receptor agonists, so it's got that similar manifestation as the cholinesterase inhibitors, but only the nicotinic effects. So we just talked about this already. This is what the organophosphates do. So here what we have is a neonicotinoid. It basically will bind the ACH receptor and cause increased nicotinic symptoms. So those are these effects that we talked about where SpongeBob is having seizures. So the management of this is to treat it like a nicotine overdose, basically supportive treatment with airway protection for those that are going to have paralysis. There's really no antidote that can help. And since we know how atropine and pralidoxime work now, we kind of can guess that those probably won't be helpful. All right, organochlorines. So these are cyclic polychlorinated hydrocarbons. They are the most commonly used insecticide in the 1940s and 50s. They've been mostly replaced by organophosphates. So you can see here, this is like DDT is good for me. This is an old thing, but we still use DDT today. So there are main categories of organochlorines. They're based on the chemical structure and similar toxicities. The ones we're going to talk about today are going to be lindane, and this is mostly in children. It's what's very classic but dangerous in children, and then DDT, which is very common. So organochlorines act as CNS stimulants by interfering with neuron function. Lindane actually is GABA antagonist. So GABA decreases seizures. So if you block that ability of GABA to decrease seizures, you're going to get increased seizures. And then DDT keeps sodium channels open. So increased sodium actually, keeping those channels open can cause seizures. So the main effect is tremors and seizures. The management for this is decontamination and then seizure control with benzos and barbiturates. All right, pyrethrins and pyrethroids. So pyrethrins were extracted from chrysanthemum flowers, which you see here. And the problem with that is that they break down rapidly in air and water, so they really have to be applied very frequently. So instead, we've developed pyrethroids, which are derivatives of those, and they're more stable in the environment. So you don't have to spray them as often. It's now one of the most common insecticides. It's in home insect repellents, things like Raid, and it's also found in parasite medications like permethrin for scabies. So pyrethrins and pyrethroids, so they bind sodium channels in their open state and keep them open. They have low human toxicity, however, because they have high affinity for the insect sodium channels more than humans, and they work at negative temperature coefficients. So insects have a lower temperature, so that helps it work, but in humans with a higher temperature, it would prevent it from working as well. Pyrethroid. So there's two types. So type 1 and type 2. Type 1 has no cyano group and it's less stable in the environment, and type 2 has a cyano group. When you think of cyano group, you probably think of cyanide though. But in this case, it actually does not have a similar mechanism to that. The big thing is that type 1 causes T syndrome, which is things like tremors, and type 2 has a CS syndrome, so chorioathetoid movements and salivation. Type 2 can actually be very similar to organophosphate, so it's kind of sometimes hard to tell the difference because they're going to have the salivation and they're also going to have the chorioathetoid movements, which may look like seizures. So it's just something to keep in mind that not all things that look like organophosphates are organophosphates. All right, DEET. So DEET is a topical insect repellent. The EPA actually allows products with 5 to 99% DEET for their website, which is kind of terrifying. But most things are usually in the 20% range. It interferes with insect chemoreceptors, so they can't find you, which is great because we hate mosquitoes, right? But it's touted to have a low dermal absorption, but the issue is that it's more absorbed if it's ingested, but also if it's applied frequently, which occurs in children, especially because of their high body surface area. You can see here this hand. So the left hand has no DEET, and it's got a ton of mosquitoes on it. And the right one was sprayed with DEET, and it has basically no mosquitoes, which is great. So DEET actually does work really well. But again, in children, we've seen a lot of neuro effects, things like encephalopathy and seizures. Okay, now let's talk about rodenticide. So rodenticide exposures are about 15,000 exposures in the U.S. per year. 80% of those exposures involve children less than 6 years old. And then another, 80% of the exposures also involve the anticoagulant rodenticides. There were 11 deaths between 2003 and 2007. 3 of those were due to long-acting anticoagulants. So basically, rodenticides are actually more dangerous to humans than many of the other types of pesticides. The EPA does restrict some of the rodenticides. They've been doing that since 2008. There's a limited sale on them. That doesn't mean that they're not around. And the way that they classify rodenticides is through this categorization. So high toxicity is an LD50 with a PO, an LD50 with oral amount that would be less than 50 mg per kg. That, per the EPA regulation on FIFRA, you would have to put on the label danger. That's that word that we talked about that would need to be on the label. For medium toxicity, it would be warning, and you see the LD50s there. And low toxicity, the caution word is caution. And you can see what that one's actually got a really broad range, a way higher range of an LD50, so it's a little safer. So the 4 things we're going to talk about today are aluminum phosphide, zinc phosphide, Brodifacoum, and Bromethalin. So zinc and aluminum phosphide. This comes in a pellet form. It's got a garlic odor, and it's used a lot in grain silos, so it can be inhaled by workers that work in those places. This is what they look like. They're little tablets. Now the issue with these are that when they're exposed to water, like if there's excess moisture in the grain silo, or if they're exposed to acid, like if you ingest them, then what happens is you can get phosphine gas. So phosphine gas is very toxic. It inhibits the electron transport chain, and it can inhibit acetylcholinesterase, actually. So you would get concerned about cholinergic effects. So the symptoms of this are very fast. They come on very quickly if orally taken. It can be 10 to 40 minutes, and if it's inhaled, it can be instant. Death is quick, by 6 hours, and that's due to cardiovascular collapse, like hypotension. So it does cause a metabolic dysregulation because of the electron transport chain inhibition. That would cause metabolic acidosis with a very elevated lactate. You can get seizures and dysrhythmias, and then the cholinergic symptoms can occur, but they're usually very mild, and they're not at all as bad as what you see with organophosphates. there is some liver and kidney injury from that metabolic dysregulation. And then if it's inhaled, you can get pulmonary edema with ARDS, and that can be actually very delayed, which is a huge issue in occupational settings. And they will have this black vomit and this rotten fish odor on their breath and their vomit. So that's something to look out for. So there's also this risk of spontaneous ignition. So aluminum is actually very flammable. I didn't find any reports or good pictures of what this may look like, but that's always a risk. So you know, you should just be aware of that they can be flammable. And then you'd want to bag up the vomitus because it's got that it's going to be off-gassing, and that off-gassing can make you ill because then you'll have a phosphine gas exposure. And if it's inhaled, you should omit them for obs, even if they're asymptomatic, maybe 24 hours, just because of that delayed pulmonary edema. That's a risk. There are some reports and studies that have been done on giving NAC and vitamin E. So basically, this is more for scavenging of any reactive oxygen species. And what NAC was shown to do in a human study was it actually decreased the duration of hospitalization and the rate of intubation. And in that study, the patients that got NAC, actually, their mortality was 36% compared with the controls of 50%. I mean, that's a pretty good risk to benefit, because, you know, NAC and vitamin E both have very low risk of giving them, and that's a high benefit. So it is recommended. Vitamin E has a similar decrease in the duration of intubation and mechanical ventilation. And in a study, when they looked at this, it decreased the mortality rate from 15% in the treatment group. I'm sorry, from 50 in the control group to 15% in the treatment group. So that's a pretty big decline too, and vitamin E is pretty safe. And if you have any patients with arrhythmias, you should give magnesium. And then for cardiogenic shock, veno-arterial ECMO may be beneficial if it's refractory. All right, Brodifacoum. So this is developed to kill warfarin-resistant rats, and it's got a prolonged half-life. So this is what we call like a super warfarin, right? Its half-life is 16 to 62 days, which is really long. So what does Brodifacoum do? So basically, to have clotting factors, what you need is activated vitamin K. So this is a cofactor. So this helps you create these clotting factors 2, 7, 9, and 10. And that allows you to clot your blood. In this case, Brodifacoum actually prevents vitamin K from being activated, so it's in its inactive form. So you don't have enough active vitamin K to make those factors, and therefore you just cannot clot. So the treatment for Brodifacoum is vitamin K supplements, and these are usually in very high doses. And also, it would be for months that you'd need to give it. It can get very expensive and deplete the supply, in fact. Bromethalin. So bromethalin has this bitter taste. It kind of looks similar, actually, to Brodifacoum, but it's got a bitter taste, and it will uncouple oxidative phosphorylation, so it can be really bad. With bromethalin, you can actually get immediate toxicity, and you'd also get that metabolic dysregulation with an acidosis, elevated lactate, and likely tremors, seizures, and coma. For bromethalin, really supportive care is all you can do. All right, herbicides. So herbicide exposures are pretty common. Actually, they're the most widely sold pesticides in the world. Greater than 45% of the pesticide market pesticide market in the U.S. is herbicides. And if you look at the top 5 pesticides sold in the U.S., 4 of them are actually herbicides. Over the last 12 years, there have been about 5 deaths per year. So I'm only going to talk about the top 2 here. Glyphosate, you probably heard about this. It's the most frequently used herbicide in the U.S. It's been banned in some countries for possible carcinogenicity. In 2017, the EPA actually concluded that it's not a human carcinogen. And then in 2018, there was this groundskeeper of a school that actually sued for non-Hodgkin's lymphoma from being exposed over a long period of time, and he ended up winning. So by the courts, it does cause cancer, and they're being sued all over the place for this. So the glyphosate mechanism, it's an organic phosphorus compound, but it doesn't inhibit acetylcholinesterase. You will not get the cholinergic symptoms like we talked about earlier. It's got an unknown specific mechanism, and it's likely multifactorial, but we do think that it uncouples oxidative phosphorylation. The mortality for glyphosate actually ranges from 2 to 30%, and it's a really common ingestion in children because of the ease of access. So the symptoms. So toxicity progresses from 12 to 72 hours, so it's pretty quick. It can be corrosive to the GI tract if ingested, and it will cause a metabolic dysregulation. So you'll get acidosis with elevated lactate, multi-organ failure like liver and kidney failure, and then encephalopathy, seizures, coma, death, right? So what's the management? You know, because of the caustic injury and that it can cause an ingestion, definitely an EGD would be warranted to look at that. If they're asymptomatic, though, you can watch them for at least 6 hours and see if they develop any symptoms. If they haven't by 6 hours, then they likely won't. And if they do have GI symptoms, you should definitely admit them for a 24-hour OB at the very least to ensure that they're not getting worse, and then supportive care. Atrazine. So atrazine is the second most frequently used herbicide in the U.S. It inhibits photosynthesis in plants, and that's how it helps with that. But it's got an unknown specific mechanism in humans, and it's likely multifactorial, but we do think that it uncouples oxidative phosphorylation, and it can be a direct arterial dilator. The symptoms you may get with this are nausea and vomiting, altered mental status, tachycardia, and then hypotension because of that arterial dilation. And then you can also get acute kidney injury and some metabolic dysregulation with metabolic acidosis and elevated lactate. The issue is that there's very few cases and very little human data, despite it being used very heavily in the U.S. So we really don't know what else it could do. And for all we know, supportive care is warranted for atrazine management, but we don't have any specific antidote. All right, and that ends my talk. I think I saw a couple of questions. If I can. Oh my God. Okay, so here's a few questions that I've gotten. Oh wait, these are not for me.
There is one, I believe that they just sent to you.
Oh, let me. Is it? I think it's the one about the vitamin K. Okay, so what do you think is fastest that can administer IVK? Oh, like central line versus non-central line? I think that's what they mean. 40 or 60 milligrams per hour. I guess I'm not sure if the question is asking, but I mean, obviously central line would probably be the best thing that you could do if you're trying to get it in at a higher rate and faster. Let's see, what's the second question? No, that's not for me either. That was the only one I got. I got another question.
Another one says, so does it mean we should buy organic fruits and vegetables?
Oh, honestly, I don't buy organic fruits and vegetables. I feel like all fruits and vegetables are basically organic. You know, the fact of the matter is, just because there's detectable pesticides and above the list that the EPA puts out, that doesn't mean, you know, there's going to be that grace between what they say is acceptable and what can cause human disease. So I still don't really buy organic fruits and vegetables. I feel like they overcharge for pretty much the same thing, and I don't really feel like pesticides are as harmful as, you know, on your food in very like residue doses as it would be if you were to ingest it or be exposed directly.
Great, we've got another question in. What is the best way to wash produce?
You know, I've heard in some places that they use sprayed vinegar. I've never done that just because I don't really like the smell of vinegar on my hands. But, you know, there are some commercial things that you can purchase to clean fruits and vegetables. And to be honest, I'm not sure exactly what's in them, if it's citric acid or something like that. But I usually just use plain old water in my hands and then a towel to kind of wipe it off. I thought I saw another question earlier about NAC. I think someone was asking, oh, here we go. Now I found the chat. Someone was asking about the NAC doses. So it's actually the same route and dose. You can either do the oral at the same doses that you would give for acetaminophen, or you can do IV, and the studies again are at the same doses as what you give for acetaminophen. So either one of those would work. Let's see what else.
I have a question. Have you, regarding the long-acting anticoagulant exposures in psychiatric patients, have you ever encountered any issues with dispositioning them to psych just because the INR effects can last for so long?
Yeah, I mean, it's not even that the INR effects last for so long. I think one of the biggest issues I've had is that the INR will not go right away. Just like in Coumadin, it takes several days to go up. So, you know, you can't disposition these people to psych. You could say, hey, in a week, you just check an INR, or if they're having bleeding, send them back. But, you know, most psychiatrists are not comfortable with that, and most psychiatric facilities are not comfortable with that. So that's been the biggest issue I've had in dispositioning patients like that. A lot of times, the physicians that are taking care of them in the hospital want to just go ahead and give vitamin K so they can send them on their way to psych, and that's really not appropriate either, because again, it's very expensive. You're basically putting them on a path to take vitamin K now in high doses for months if you do that, because the INR will not be appropriate in that case. So yeah, I've found that to be more problematic than somebody with an INR that's elevated and then sending them with vitamin K. And I have no answers for that. Usually I'm like, just please, if you can do that, that would be great. Or, you know, you have to keep them in the hospital for 3 days and check the INR until you can say that it's not been elevating. Someone mentioned what are the common names of glyphosate and atrazine. For glyphosate, that's Roundup. For atrazine, I meant to look that up, and I'm not sure what the common name of that is. Someone may know.